You are welcome to our page. Here is the question from mental health, an Nmcz question from one of the mental health past paper. And the question says, Mr. Mambo, aged 30 years, is brought to Chainama Hospital Ward X with a history of wandering about and self-neglect for the past 3 months. On admission, the doctor conducts a mental state examination and a diagnosis of dementia is made. The first question says define dementia. Second says explain 5 cause or predisposing factors of dementia. Then the third one says state 5 cardinal signs of dementia. And then number 4 question says discuss how you are going to nurse Mr. Mambo during his stay in hospital. So, the main objective to the question, or rather of the question, you must be able to know what dementia is. Know how it comes about, what are the cause, predisposing factors. Then know also the cardinal signs of dementia and its management at par. Then you are done. So we are going to look at these questions and answer them vividly. Contributions, additions, they are most welcome. You can also do that. You're really welcome. Okay. So the first question here says, define dementia. What is dementia? Answer. Dementia is a syndrome characterized by progressive, usually irreversible global cognitive deficit such as memory, language, emotion, and personality, which is of sufficient severity to interfere with one's normal and occupational functioning. That is what we mean by dementia. So in other words, dementia is just a syndrome where the patient has multiple cognitive deficit and memory loss sufficient to impair occupational or social functioning. We call that as dementia. Are we together, friends? Going to the second question, it says explain 5 causes or predisposing factors of dementia. What are the cause or rather predisposing factors of dementia? You are seated in an exam room. The paper is in front of you. Then here's the question which comes your way and says explain 5 cause or rather predisposing factors of dementia. Answer. Number 1, Pick's disease due to frontotemporal lobe degeneration. That is number 1 cause. Number 2, Alzheimer's disease, which is due to neurodegenerative changes. Then number 3, it is vascular dementia due to impaired blood flow to the brain. The other ones are general medical conditions like people with HIV and AIDS. Also, substance induced due to increased toxins to the brain. Huntington disease due to breakdown of the nerve cells. Head trauma, Creutzfeldt-Jakob disease, and Parkinson's disease. All these are predisposing factors or rather causes of dementia. Like number 1, we said Pick's, which is Pick's disease due to frontotemporal lobe degeneration, followed by Alzheimer's disease, then vascular dementia, which is due to impaired blood flow to the brain. People with HIV, generally we can just say general medical conditions. Substance induced due to increased toxins to the brain. Huntington disease, which is due to breakdown of the nerve cells. Head trauma, Creutzfeldt-Jakob disease, and Parkinson's disease. All these are causes of dementia. You can pick 5 from there. Okay? Moving to question 3, it says state 5 cardinal signs. State 5 cardinal signs of dementia. How do you respond to this question? It is telling you to state 5 cardinal signs of dementia. Answers: number 1, memory impairment. Okay, so memory impairment, it may even be short, okay, short term, or progressive, which may be long term. And this is just the impaired ability to learn new information or to recall previously learned information. Number 2 cardinal sign is impairment in abstract thinking, judgment, and impulse control. That is number 2. Number 3 cardinal sign of dementia is aphasia. Now, aphasia, this is just the difficulties in naming objects or in speaking. Then apraxia is the loss of ability to carry out purposive, complex movement and to use objects properly. Personality disintegration. Now, under this one, it is the history of personality changes, actually. Forgetfulness, social withdrawal, diminished self-care, apathy, fatigue, deteriorating executive functioning, and so on. The other cardinal is the significant impairment of normal functioning, followed by hallucinations and delusions, often paranoid, anxiety and depression in some manner, as well as wandering and disorientation. All these are cardinal signs of dementia. Are we there? So if the question came in an exam asking you to explain, rather write about cardinal signs of dementia, those are the signs: memory impairment, impairment in abstract thinking, judgment, impulse control, aphasia, apraxia, impaired executive functioning, personality disintegration, significant impairment of normal functioning, and so on and so forth. That is how we explain it. Now we go to the last one, which says discuss how you are going to nurse Mr. Mambo during his stay in hospital. Now remember, Mr. Mambo is aged 30 years and is brought to Chainama Hospital Ward X with a history of wandering about and self-neglect for the past 3 months. These two are signs also: wandering and self-neglect for the past 3 months. On admission, the doctor conducts a mental state examination and a diagnosis of dementia is made. Okay? And he was actually found that he had dementia. Now, here the question says discuss how you are going to nurse Mr. Mambo during his stay in the hospital. So, first and foremost, you're going to exhibit what is called nursing care. Under nursing care, the following should be written. Are we together? The following should be written. 1. Aims. Number 2, specific nursing care. Number 3, under it, environment, observation, medical or rather psychopharmacology, psychosocial rehabilitation, individual psychotherapy, establish a therapeutic relationship, group therapy, family therapy, behavior therapy, occupational therapy, recreational therapy, psychological care, supportive therapy, peer therapy, hygiene, nutrition, rest, injury prevention, medical advice. All these are points that which we are going to write about the care which should be rendered to Mr. Mambo as he is admitted in the ward. So how is the skeleton of our writing? So like I said on my preamble, I said nursing care. It starts with M's. So you put M's there, such as to rehabilitate the patient. In this case is Mr. Mambo. Are you following me? Then number 2, to relieve the signs and symptoms. Mr. Mambo has got signs, wandering and self-neglect. So we need to relieve these signs and symptoms. Then number 3, to prevent injury. He is having dementia. So these are the signs that, the M's I can say that we are going to, nurse care. So when you have put like that, then you are going to write specific nursing care. Specific nursing care. Under this specific nursing care, this is what you are going to explain. 1, to maintain calm manner of the patient, or with you and the patient. Number 2, interrupt periods of unreality. Teach relaxation exercises to be used when anxious. Provide simple and structured environment to minimize confusion. Identify self-care deficit and provide assistance as required. Then orient to reality, which is time, place, or person, frequently. Allow plenty of time for the patient to perform tasks. Then teach the caregiver successive methods preventing harm to the patient and orientation of the patient, as well as maintain low level of stimulation such as sounds, light, too many visitors, etc. All those should be led to increase. All those actually may lead to increase, anxiety. So now, your specific nursing care, having written like that, it should then follow up with the environment, observation, medical or rather psychopharmacology. So under the environment, how is the environment be or must be for the patient to be nursed? Number 1, the room should be clean. It should be well ventilated. And the patient may be isolated if being danger to others or himself. The furniture should be removed from the ward where this patient, who is Mr. Mambo, is being nursed from, in order to prevent injuries, and it should actually stimulate that kind of freedom, or rather free environment. The environment should be well ventilated to promote comfort. Okay? It's very important that it should be in that way. Then ensure that the environment is free from stressful, stimuli. As stress increases, vagal activities, which basically may worsen the condition. Then under observation, make sure that you observe all the general condition of the patient. Any changes in mood and suicidal ideations, all those should be observed clearly. Also observing the sleeping pattern, the feeding pattern, they are very important that they should be observed in that. Observe their levels of activities and their general behavior, noting signs and symptoms of depression. So it's very vital that Mr. Mambo is nursed in that way. Then under medical pharmacology, or rather psychopharmacology, this is actually the field of science which analyzes the impact of different drugs' effect on the mental health of patients. So instead of just looking at the patient, it's very important that also they are induced with some drugs which basically may stabilize their mood as stabilizers. Are we together there? Then, having looked at all these, you also need to exhibit psychosocial rehabilitation, which basically promotes personal recovery and successful community integration and satisfactory quality of life. So this involves assisting the person with mental illness to regain skills and minimize functioning in the community. In this case is Mr. Mambo. So the process of restoration of community functioning and well-being of an individual diagnosed with mental health or emotional disorder, it plays an important role to rehabilitate this colleague of ours. Then individual psychotherapy. So under this one, this is just the process through which the client work one-on-one with the trained therapist in a safe, caring, and confidential environment to explore their feelings, beliefs, as well as the behavior. So this therapy would actually help overcome obstacles, their well-being. It can also increase positive feelings such as compassion and self-esteem, which is basically confidence in them. Then establish a therapeutic relationship. So if a nurse-patient relationship is enhanced, the patient can learn how to find satisfaction in other human relationships. So the nurse-patient closely, physically and psychologically, it's very important that they should exhibit this factor to them. But when you look at family therapy, so under family therapy, when you look at it, the family members should educate on the patient's condition so as to accept the condition as being part of the family and part of avoid any stigma and rejection by members of the family. So it's very important that others must always be involved in the plan of care, since intimate relationships are always affected by maladaptive responses, especially for when someone manipulates patients who can turn relatives against staff or vice versa to distract attention from self. Okay? Then behavior therapy, this is one of the things that you can also do to Mr. Mambo. So you limit setting on all the interactions and behaviors, realistic limits about what can and cannot be done for the client. Use reinforcing techniques and consequences to achieve desired goals. So reinforce also with something concrete that is readily available, because material rather than emotion rewards are preferred. Discourage bad behaviors in patients at all cost. You may use reinforcement with patient does something good and with reward when they do something bad. Physically aggressive patient may be told they need to tighten up restrictions and also issues an ultimatum. Okay, so Mr. Mambo should be next in that way. What about occupational therapy? Under this one, this is what I'm thinking. This treatment focuses on helping people with physical, sensory, cognitive disability be as independent as, possible in all areas of their lives. Train the patients. Train Mr. Mambo on in his survival, because he may not continue with their current employment. Okay. Then the other thing also here is the recreational therapy, which can help nurse Mr. Mambo. So under this one, it's just a systematic, progress or process that utilizes or uses recreation and the activities based on interventions to address the assessed needs of individuals with illness or other disability. So use some kind of varieties of modalities, including arts, crafts, drama, music, dance, sports, games, and so on and so forth. But when it comes to psychological care, you need to explain the condition to the patient in simple terms and in language the patient can understand. Involve Mr. Mambo and the family in the care. You involve them. Also explain the procedures to the patient, to Mr. Mambo, before carrying them out. It's very vital. Allow Mr. Mambo to ask questions and answer them appropriately. It plays an important role because you are forming that positive relationship between you and him. Support Mr. Mambo in all cases. This may actually reduce, psychological conflict and it strengthens Mr. Mambo's ability in some way. Okay? Assist Mr. Mambo with bathing, which is under hygiene. Assist him with bathing involving the friends. If basically not friends, then the family, if there are some cases of beyond. Assist Mr. Mambo with bathing to promote comfort and promote blood circulation and remove deity. Do oral care to promote appetite and encourage him to be changing clothes after bathing. So, having done all that, then monitor Mr. Mambo's feeding pattern, as it may be that it may improve in some. Now, this is what I'm trying to say. You monitor Mr. Mambo's feeding pattern as a patient with psychotic disorder. Okay, tend to be more suspicious. Okay, so patients to be fed on normal dieties in order to maintain their nutrition statuses. Are we there? Then encourage them also to be taking fluids and foods in high roughage in order to maintain the fluid volume and prevent constipation. It is also important that you ensure adequate rest for the patient by keeping Mr. Mambo his environment free from stimuli. Sedations may also help them rest. The environment should support both mental and also physical rest. Therefore, they nurse patient in a quiet environment to promote rest as the patient mental illness is experienced. Okay. Then, if the patient basically exhibits so much aggressively, monitor the aggressive patients closely because they may be danger to others and themselves. All the equipment should be removed. Examples, the furniture and so on. Okay. Now, having done all these in a shortest period of time, then it is also important that you state the medical advice. Very important. So if the patient is to be discouraged, whom the family needs clear understanding of the residue deficit. The family and the patient need to have a realistic expectations about the patient's abilities. Okay, then emphasize on the need of the physiotherapy if there is a residual disability as rehabilitative measures. Okay, so those are the points you can exhibit to Mr. Mambo. Otherwise, this was mental health. Thank you so much, and this was just a summary. You can add on how you feel and the skeleton of the management per se, and we shall really appreciate. Thank you so much for your time. God bless you abundantly.